Welcome back to Midnight Med. This video is on myelofibrosis. Myelofibrosis is fibrosis of the bone marrow from myeloproliferative neoplasms. They can be primary myelofibrosis, so there's no clear preceding cause, or secondary myelofibrosis, such as from chronic myeloid leukemia, erythrocytosis, or increased red blood cell production, or essential thrombocythemia, so related to platelets. Anyway, these abnormal myeloid precursors lead to growth factors such as TNF-alpha and IGF, and this increased fibroblast activity, which activates fibroblasts, which causes fibrosis. Clinical features relate to suppression of the bone marrow, so features of pancytopenia. So from anemia, you can get weakness or fatigue, and you can also have weight loss and fevers, constitutional symptoms. Due to the increased cell turnover, you can have hyperuricemia, so manifesting as gout. In the early stage, you can have thrombocytosis and leukocytosis, where the leukocytes and platelets are initially elevated, and this is early stage as the bone marrow tries to produce more of its components, of its cells, but these don't become mature, so they're immature cells. And later stage, the bone marrow is unable to produce these cells, and you get the pancytopenia. On examination, you can have hepatosplenomegaly, and this is due to the increased immature or precursor cells being produced, and they have to go somewhere, so they go to the spleen as well as the liver. Diagnosis includes a raised leukocyte, so that's, remember, leukocytosis of the early stage, as well as evidence of increased cell turnover, such as ALP, LDH, and uric acid being elevated. You can then do a blood film, so peripheral blood smear, and what you're looking for are dacrocytes or teardrop-shaped red blood cells, which are indicative of extramedullary hematopoiesis. Leukoerythroblastosis is evidence of bone marrow infiltration or suppression from fibrosis in this case, and what it means are that the red blood cells are nucleated and they're immature white cells because it's been produced a lot, but they're not being given time to mature. And finally, you can do a bone marrow aspiration, which should show fibrosis. Management, curative, if it's a younger patient with good prognosis, you can do a stem cell transplantation. Other supportive or symptomatic treatment includes aspirin, because you want to reduce the chance of clots forming due to the increased platelets. You can also do transfusions where you're giving them healthy blood, so a healthy amount of red blood cells, leukocytes, and red blood cells, as well as a J8K2 inhibitor, because that's a gene that's often associated with myelofibrosis. Radiotherapy and splenectomy are other options. So when we talk about a splenectomy, you should also understand the function of the spleen, so what's going to happen when you take out the spleen. So the spleen function can be broken down into white pulp and red pulp. So white pulp is involved with the immune response, both humoral and cell-based immunity. It is a site of antigen presentation, so when a dendrite, for example, picks up an antigen and presents it to, for example, CD4 cells, this occurs in the spleen. Antibodies for blood-borne diseases are also sourced in the white pulp of the spleen. Red pulp is the vascular component of the spleen and is composed of sinusoids. They remove old or defective red blood cells through hemolysis, as well as removing platelets and storing blood. It's a blood reservoir. Prognosis is quite poor, with the median for primary myelofibrosis being 5 years, and it's been especially unfavorable if you have a low hemoglobin. Causes of death include hemorrhage, sepsis, thrombotic events, and if they happen to develop acute myeloid leukemia. Hemorrhage can occur late stage due to the lack of platelets. Sepsis, as you're more prone to infection in the late stage with reduced neutrophils, reduced leukocytes, and thrombotic events in an early stage where you have increased platelets and thrombocytosis. Thank you for watching. I hope you learned something. If you did, please tell a friend who may also find it useful.